We will do L for 5 transforaminal neuroplasty through Cambin's triangle approach. For that first, we will do true AP, end plates, parallel and ipsilateral oblique. Just in front of the SAP above pedicle will be our entry. Insert the needle and look for lateral view for depth and insert more till final position.
Wow.
In AP view, insert the catheter till the traversing nerve root for neuroplasty.
Basically, I need to reach close to the midline because you have to understand where is the tower. Yes, that is the root of the towers. Okay, hold it. Mostly the exiting nerve is same, but traversing nerve is also same.
With catheter, to and fro, movement is done to make nerve root free from impingement. Traversing nerve is seen better now compared with previous image.
Can see it, that's that part.
The constriction hypoechoic near
hypervascular
near the pedicle.
Yes. Just medial to the pedicle.
L5 pedicle.
It is starting from there.
Yes, sir.
Just the lower part of the disc, and it is coming down.
Yes.
That is actually the hypolucent area is because of the migrated disc.
Again with catheter, to and fro. Movement is done to clear the nerve root impingement.
Still that is hypolucent, but still some dye is coming.
Yes.
Right.
So we'll be going lower side.
Take him. But that I cannot reach.
Yes, sir.
But I'm just trying to move my distal side little down.
Normal saline of around 10 milliliters is injected. One last time catheter is inserted and clearance is done. Normal saline is injected again. Then steroid is given along with local anesthesia and needle is removed.
Okay.